And today I have Jena Satchell with me today, and she's one of our patients, and she wants to share her headache experience with us. Thanks for coming today.
Well, thank you for having me.
And I think to start, first of all, I want you to describe your migraine type headaches, like where they're located, what the quality of pain is, and so forth.
So that has changed over the years, of course. The last 5 years, most of my headaches start on the right side of my head. But generally speaking, when I get a migraine that's a 6 or above, I really feel the pain throughout my entire head. Most of the time, though, it does start on the right side.
And how would you describe the pain? Is it a sharp pain or a dull pain, or is it throb or pulsate, or how would you describe the pain?
So obviously it varies with the degree of severity of my headache. When I have what I call a severe headache or a migraine, I get an aura. I am sensitive to light. It's a throbbing pain, but you know, when my husband asked me how I would describe it, it literally feels like someone is crushing my skull, like there are hands on my head and they're pressing inward. And that's what happens when I have a severe headache.
Okay. And what kind of effect do these headaches have on your life?
Oh, well, I can't even describe the way my life, first of all, has changed in the last 6 years. As you know, I've been suffering from migraines for 12 years now. And the first 6 or 8 years or so, my quality of life was close to nothing. I had migraines 15 to 20 days a month. I couldn't function as a mother. It was difficult for me to function as a wife. It was difficult for me to work and concentrate on my profession. And about 15 to 20 days a month or so, I was what I would consider down and out. You know, I couldn't function. I couldn't leave my house. I couldn't attend my son's sporting events, or I missed a lot of work. In the last 6 months, or in the last 6 years, my quality of life is fantastic, to be honest with you. I've had 2 instances in 5 years where the migraine was debilitating, you know, where I was actually in bed for a couple of days. But aside from that, for the last 6 years, when I get a migraine, I can feel it in my head, but it doesn't affect my daily routine. I'm still able to attend my son's functions. I'm able to participate in things that make him happy. I'm able to be a wife and a executive at my company and have gainful employment, and so that's great.
Now, what was the diagnosis of migraine made right off the bat by your treating physicians, or did it take a period of time?
What's interesting is that I believe that I've been suffering from migraine since about 1998. It wasn't until 2004. My son was 2 years old. I was traveling to a business call in Dayton, and I just had a headache that seemed like every day it got worse, and I didn't really know what it was for. Or what caused it. I was taking, way too many Tylenol and Advil to mention. And over the course of 2 months, it got to a point where I blacked out from the pain and I was hospitalized. I left the hospital after a couple of weeks without a diagnosis. When I left, I was on Duragesic patch, Dilaudid,
which are narcotic pain medications.
Narcotics, and I got home, and you know, as I'm at home after I got released from the hospital, I looked at my life and said, how am I supposed to function like this? So then I went to a clinic in Chicago, and it was there that I was diagnosed. So it did take a period of time for me to actually get the diagnosis of chronic migraine.
Okay. And why don't you tell us what kind of therapies that you've received over the years for the headaches?
Quite a bit. When I first started coming to you at the time, I believe that I was on Depakote at that time with some other medications. I didn't see a noticeable improvement. Also, the reason that I found you here in Cincinnati, the Depakote caused me to lose my hair. And there were numerous treatments over the first 5 or 6 years. When I started coming to see you, we were able to, I think, regulate my medication. That is all contributed to now a lifestyle that I have today.
Okay. And what therapies did you find that were the best for you?
Right now, I would have to say that the Botox is the most effective form of therapy. I've been doing Botox now for about 6 years. There were times for financial reasons that I tried to spread it out a little bit and go, instead of every 3 months, I'd try to stretch it to 4 or 5. And there's a noticeable difference, for me anyway. I can tell when the Botox is starting to not be as effective. When I do it regularly, every 3 months, which I've been doing now for several years, again, I feel like I still get headaches, but nothing that's debilitating. It enables me to, it has truly changed my quality of life, and I attribute that to the Botox therapy.
Okay, and then what do you take when you need to get rid of the headache right away? Your acute therapies.
I will occasionally, and I try to stay away from the Toradol injection. I would say that over the last 5 years, I have utilized that as a form of relief maybe 12 to 15 times. That seems to be pretty effective. And then I'll take Advil when I feel a headache coming on. But not so much for addressing an immediate headache. Typically, I can feel those coming on and will do the things that I need to do. Some biofeedback, I'll sit in a quiet room, I'll do whatever I can to try to keep it from getting to a 5 or a 6 or a 7.
Okay. So did you respond to those medications called triptans, which are like Imitrex or those kind of meds?
I did not respond to those forms of therapy. We did try them. I was on Imitrex, I believe, and this is dating back probably 10 years, a couple of years into my diagnosis. They just were not an effective form. They didn't help me at all, the triptans.
Okay. Which happens probably in about a third of patients. They just don't respond to those medications. Now, can you tell us what kind of trigger factors you might have for your migraines?
Stress is definitely a trigger for me. I'm in a profession that, and have been, that requires me to work a lot of hours, unfortunately. And in a high-stress profession like mine, it seems I can typically tell when I have a long week or a long day. I can typically tell when that, for me, has been a trigger for headaches.
Okay. Any other triggers, like menstrual periods or any foods or beverages? Or
I haven't noticed any. I was trained, I was educated on some of the food triggers, so I stay away from things like aged cheese, wines, which is unfortunate. I try to stay away from the trigger foods that I learned about 12 years ago. And so I don't notice that food necessarily is a trigger for me.
Okay. How about weather changes or any environmental factors?
I haven't noticed that so much. Also, with menstruation, that has not been a trigger for me, or it wasn't for a period of 10 years. I guess we'll see soon here, won't we?
So what would you tell patients, what advice would you give them about headaches?
I think the best advice that I can give is, first of all, make sure that you educate yourself on the causes of headaches and the types of headaches that you're getting. I have people in my family who suffer from migraines as well, but they suffer from different kinds of migraines. My uncle, for example, gets cluster migraines. So I think make sure that you educate yourself. Certainly work with a trusted healthcare professional to make sure that your symptoms are being managed, and get a treatment plan that works for you. It took me 5 or 6 years to find a treatment plan that was actually effective. And the change in my quality of life during that period of time was tremendous. So just don't stop seeking advice from your healthcare professional. You're here to help us.
I think it's important to also note, as evidenced by your kind of journey of migraine, is the fact that there can be many different therapies that work for people. Not one therapy may work for one person, but it may not work for another person. So there needs to be some individualization of therapies as well.
I would agree with that.
So, all right. Well, thank you very much for this interview.
Thank you. Thank you for having me. I appreciate it.